bicep is a big muscle that lies on the front of the arm. The bicep is attached to the shoulder by the proximal bicep tendon. The bicep is also attached to the radial tuberosity below the elbow by the distal bicep tendon. The biceps help in flexion of the elbow and in motions like turning a doorknob. Tendons attach muscles to bones. Your bicep tendons attach the bicep muscles to the bones in the shoulder and in the elbow. If you tear the bicep tendon at the elbow, you will lose strength in your arm and be unable to forcefully turn your arm from the palm down to palm up. Proximal bicep tendon tears, the muscle moves towards the elbow and becomes a big ball of muscle called the Popeye muscle. A rupture by the distal bicep tendon occurs by the elbow and is most common in men. Lifting a heavy box is a good example of the mechanism of this injury. Perhaps you grab it without realizing how much it weighs. You strain your bicep muscles and tendons trying to keep your arm bent, but the weight is too much and forces your arm straight. As you struggle, the stress on your bicep increases and the tendon tears away from the bone. In this case, the athlete was bench pressing at a weight of 120. Athlete heard a pop and experienced an immediate onset of pain in her forearm that radiated to her shoulder. The factor for this injury is men aged 30 years or older. They're more likely to tear at the distal bicep tendon, which is closer to the elbow. Additional risk factors for distal bicep tendons tears include smoking. Nicotine can affect the nutrition in the tendon. For proximal tear, which is closer to your shoulder, older people are more at risk. They have years of wear and tear on their tendons than younger people. People who do heavy overhead activities like too much loading during weightlifting is a prime example of this risk, but many jobs require heavy overhead lifting and put excessive wear and tear on the tendons. People who have shoulder overuse, also repetitive overhead sports such as swimming or tennis, can cause more tendon wear and tear. This is an MRI of a torn proximal bicep tendon, which is closer to your shoulder. As you can see where the arrow pointing, instead of there being a solid black blur, there's kind of a white line going through it. Symptoms of this injury is a sudden sharp pain in the upper arm, sometimes an audible pop or snap, cramping of the bicep muscle with strenuous use of the arm, bruising from the middle of the upper arm down towards the elbow, weakness in bending elbow, and weakness in supination, which is motion such as turning a key or a doorknob. A common test used to know if you have a distal tear is the hook test. Basically what you do is you put your elbow in a flexed position, then palpate from the lateral side. If you can hook your finger around a tendon, then there is no tear. If you can't hook your finger, then there is a tear distally. The physical examination that was performed on the athlete showed that there was no swelling, and the extension/flexion was at almost at a normal rate. A normal rate would be all the way to 140, and the athlete got it all the way to 135. She also had mild weakness in both flexion and supination when compared to the opposite side. She also presented weakness to resisted supination with positive tenderness at lateral epicondyle, which the movement of this joint is moved a lot when you play tennis. There is also positive tenderness at the antecubital fossa. There is also positive tenderness at the medial epicondyle. The treatment that was chosen to be used on this athlete was a non-surgical treatment. It's called a PRP shot, or a platelet-rich plasma injection. Basically what they do is your blood is drawn and then spun down to isolate the healing platelet cells. The cells are injected into the area of the injury to stimulate healing. When you get this surgery, there is lots of inflammation, but you can't take any type of medicine or ice because the inflammation is the point of the surgery, because it helps kickstart the healing process. Doctors use several procedures to reattach the distal bicep tendon to the forearm. Some doctors prefer to use 2 incisions, while others only use 1. There are pros and cons to each approach. Sometimes the tendon is attached with stitches through holes drilled in the bone. Other times, small metal implants are used to attach the tendon to the bone. On the left, there is a photo of an x-ray showing the metal implants called suture anchors that have been used to secure the tendon to the bone. In this case, the return to play for the athlete was about 8 weeks with limitations. The first half of practice is spent doing rehabilitation, while the second is spent practicing or conditioning. No set limitations on games. The athlete plays to pain or noticeable swelling. This routine will probably be used for the next 6 months.